that can open up new ways of looking at the question of an afterlife. Also, deathbed visions. Deathbed visions are a phenomenon which that during the last few days or hours of life, terminally ill patients seem to be engaging with some other state of existence. For example, they start talking to relatives or friends of theirs who have already died, as though they can see them in the room and converse. And incidentally, I've seen this many times in my medical career because I've worked quite a bit with terminally ill patients. And this kind of state of consciousness is very interesting because, in my experience, the patient realizes that the doctor is not aware of this, which is interesting. If this were a psychotic kind of experience, the patient wouldn't realize that. But as a matter of fact, I've had over the years several patients who kind of humorously turned to me as in an aside and just kind of laughed about this, saying, well, doctor, I realize that you can't see my father who's here in the room, but I can. So people seem to open up to this transitional realm during the dying process, and they seem to be in the midst of this in a clear state of consciousness. This is not clouded consciousness, but at the same time that these people are talking to their deceased relative, they also can talk with you very coherently about things in the room. So it's not an experience of clouded consciousness. It seems to be an experience of opening up into some other kind of reality.